The organ transplantation landscape in the U.S. is undergoing its biggest transformation in decades, marking a pivotal moment for patients, families, and healthcare professionals alike. For years, the system has faced criticism for inefficiencies, disparities, and outdated processes, but now, sweeping changes are on the horizon. Effective July 2025, a major overhaul led by the Health Resources and Services Administration aims to modernize the system from the ground up. This initiative is not just about policy, it's about fundamentally rethinking how organs are allocated, transported, and matched to recipients. The goal is to save more lives by creating a more equitable, transparent, and patient-centric network. By focusing on fairness and accessibility, the overhaul seeks to ensure that every patient, regardless of background or location, has a better chance at receiving a life-saving transplant. A new independent OPTN board of directors will provide oversight, aiming for 60,000 successful transplants annually by 2026. This board will bring fresh perspectives and accountability, setting ambitious targets and tracking progress closely. HRSA and CMS are driving performance improvements, targeting the 56 organ procurement organizations. Their focus is on raising standards, increasing efficiency, and ensuring that best practices are shared across the country. This overhaul addresses systemic weaknesses, moving to a data-driven system to ensure every organ reaches a recipient in time. Enhanced technology and real-time tracking will help eliminate delays and reduce the number of organs that go unused. By fostering continuous improvement, these changes promise a more efficient and equitable process, reducing wait times and bringing hope to families nationwide. The July 2025 overhaul represents a new era, one where innovation, compassion, and accountability work together to save more lives than ever before. A key reform is the increasing organ transplant and donation model from CMS, transforming OPO performance. The IOTA model introduces clear, objective standards and financial incentives, rewarding excellence and accountability. Operating from 2025 to 2030, it focuses on donation rates, organs transplanted per donor, and cost-effectiveness. This shift from process to outcomes ensures OPOs innovate to maximize lives saved. Transparency allows fair comparisons, sharing best practices to increase organ recovery. The IOTA model aims to save more lives, reduce disparities, and build public trust in organ donation. The overhaul of the transplant system is a significant step forward in promoting equity and access for all patients, regardless of their background or circumstances. By dismantling barriers that have historically disadvantaged certain groups, the new approach aims to ensure that everyone receives fair consideration and opportunity. One of the most impactful changes is the removal of the race-based variable in kidney function assessment, which corrects a long-standing inequity in how patients are evaluated for transplants. For Black patients, this means their waiting times are now recalculated, restoring valuable time that was previously lost due to outdated and flawed algorithms. Another important reform is the removal of the mandatory disclosure of a donor's hepatitis C status, which reflects the latest medical advancements and a better understanding of treatment outcomes. This change helps to destigmatize HCV-positive organs, making more organs available for those in need and giving hope to patients who might otherwise face longer waits. Together, these reforms are creating a fairer, more compassionate system, one that empowers patients, expands the donor pool, and prioritizes health equity. The ongoing commitment is to make the transplant system not only more efficient, but truly equitable and accessible for every individual in need. The reformed system emphasizes patient empowerment through multiple listings at transplant centers. This strategy increases chances of receiving an organ offer by expanding access to a wider donor pool. Patients must be proactive, navigating different hospital criteria and evaluations. Transparency in hospital practices helps patients make informed decisions. The portability of waiting time ensures patients aren't penalized for seeking better opportunities. This approach shifts power to patients, allowing them to improve their odds. Flexibility benefits those willing to travel, opening possibilities for shorter wait times. Kidney allocation is guided by a data-driven framework designed to optimize both patient and graft outcomes. This approach uses advanced analytics and evidence-based criteria to ensure that every donated kidney is matched as effectively as possible, taking into account a wide range of medical and demographic factors. The KDPI score, or Kidney Donor Profile Index, evaluates the expected longevity of a donor kidney. By analyzing donor age, health history, and other clinical variables, the KDPI helps ensure that the healthiest, most viable kidneys are allocated to recipients who stand to benefit the most from a long-lasting transplant. On the recipient side, the EPTS score, or Estimated Post-Transplant Survival, predicts how long a patient is likely to thrive after receiving a transplant. By matching low KDPI kidneys with low EPTS candidates, the system aims to maximize the years of healthy life gained from each transplant. This synergy between donor and recipient scoring maximizes life years gained, ensuring that donated organs are used in the most impactful way possible and that more families can celebrate successful outcomes. The allocation system moves beyond simple blood type or tissue matching, incorporating predictive analytics and long-term outcome projections to create more durable, meaningful impacts for patients. Logical, evidence-based matching not only improves individual patient outcomes, but also enhances the overall effectiveness of the transplant program, benefiting both recipients and society as a whole. This advancement in kidney allocation represents a significant step forward, aiming to maximize the benefit and reach of the kidney transplant program for all